Hello, ma'am.
Hello,
Ma'am, shall we
am I
begin?
audible?
Yes, ma'am.
Yeah. We'll start.
Learning is the beginning of wealth. Learning is the beginning of health. Learning is the beginning of spirituality. Having a heart to start learn is where the miracle process all begins. Good evening, everyone. With great joy and immense pleasure, I extend my warm welcome to all the dignitaries, guests, and delegates present here for the Dr. Sudhir Raj N. Memorial Free Webinar Series organized by DIKSHA E-Learning in association with Ayurveda College Coimbatore under the banner of Azadi Ka Amrut Mahotsav. In today's session, we will be discussing about Tridosha Siddhant by Dr. Prathibha Vijay Kulkarni. Before starting the session, I would like to go through few of the basic instructions to be followed throughout the session. For uninterrupted class session, use laptops with high-speed internet connection. Please make sure your microphone is on mute to have a disturbance-free session. In case of any disruption, please check your internet connection firstly, and if the problem is within our network connection, kindly raise the issue in the chat box. Filling your full name to be displayed is appreciated. Any questions can be posted in the chat box. Questions raised will be clear at the end of the session. Next, I would like to invite Dr. Vadivu Karasi, Assistant Professor, Department of Kriya Sharir, Ayurveda College Coimbatore, to deliver the welcome address.
Thank you. Good evening, one and all. On behalf of Ayurveda College Coimbatore and DIKSHA E-Learning, it gives me an immense pleasure to extend a very warm welcome to our eminent speaker, Dr. Prathibha Kulkarni, ma'am, to detail about Tridosha Siddhantha. Welcome you, ma'am. Once again, we proudly welcome all the delegates who have joined with us today. Welcome you all once again. Thank you.
Thank you, ma'am.
Shall we start? Okay.
It's a great pleasure for me to introduce our guest speaker, Dr. Prathibha Vijay Kulkarni. Dr. Prathibha Vijay Kulkarni, ma'am, is currently working as Professor, Department of Sharira Kriya at SDM College of Ayurveda and Hospital, Hassan. Ma'am has graduated from Karnataka University of Dharwad and done post-graduation in Siddhantha. Ma'am has teaching experience from 2003 till date in various colleges. Ma'am has attended many seminars and has delivered many guest lectures. Ma'am has 58 publications in peer-reviewed and indexed international and national journals. Ma'am has presented papers in various national and international seminars. We are extremely privileged to have you here in this platform, ma'am. Now, without any further ado, we will turn the time over to respected Dr. Prathibha Vijay Kulkarni, ma'am, to enlighten our minds with her knowledge. Over to you, ma'am.
Okay. I welcome all of you for today's session. I am going to deliver lecture on Tridosha Siddhanta, which is a very basic topic of Ayurveda. Next slide, please. Next slide, please. Yeah, next slide. Yeah. Introduction. Previous one. Previous slide. Previous slide.
One second, ma'am.
Previous. Yes. Moving on to the introduction for today's presentation. Let us start with the aim of Ayurveda. Aim of Ayurveda is to prevent the diseases and cure the diseases. That is swasthasya swastha rakshanam and aturasya vikara prashamanam. These two are the aims of Ayurveda. Ayurveda also deals with the aim of attainment of moksha with the help of attaining dharma, artha, kama, and finally moksha. Dharmartha, kama, mokshanam is the moola or is the aim of Ayurveda. Like in Charaka Samhita, it is told as dharmartha, kama, mokshanam arogya moolam uttamam. For the attainment of moksha, for the attainment of dharma, artha, and kama, arogya is the moola. Arogya is the base for attaining all these four aims. That is why we have to take care of arogya, and we should do all the efforts how to keep free from the diseases. With the help of attaining moksha, we can attain moksha with the help of these two aims. As health is required for the achievement of dharma, artha, and kama moksha, one has to take care of their health with the help of prevention of the diseases. For providing good health, physician has to know how our body has made. What are the basis of our body? A physician should know. Then only he can do proper treatment. With the help of proper treatment, health has to be maintained and moksha has to be achieved. Next, please. Next slide. Yeah. Here, the text which deals with the study of Sharira is called as Sharira Shastra. And if it deals with the study of human body, it is called as Manava Shariram. The study which we are doing with the help of human body, keeping human body as the base, the study or the science which we are learning, that is called as Manava Sharira. And again, it is divided into two parts, that is Rachana Sharira and Kriya Sharira. Rachana Sharira is called as anatomy, Kriya Sharira called as physiology. Next one. So that the study which deals about the structure, composition, situation of different parts, different organs of the body, that is called as Rachana Sharira, or also we can call it as anatomy. And Kriya Sharira, it deals with the study of nature and functions of different organs or different systems, how they are working in our body. To study all these things are part of Kriya Sharira. Otherwise, if we want to study Rachana Sharira, we need to study about the structure and of the different parts, how they are located, where they are located. Regarding this study is called as Rachana Sharira. And regarding the physiology, normal functioning of the body parts, it comes under Kriya Sharira, or it also called as physiology of Sharira Kriya. Next one. Next, please. Yeah. According to the modern science, the term physiology is originated from the Greek word physiologikos. It is made up of physio and logikos. Physiology word is derived from a Greek word which is called as physiologikos. Physios is a nature, logikos is a science. So the science which deals with the nature, that is called as physiology. It deals with the normal functioning of various organs of the body, and it was invented by a French physician, Jean Fernel, during 1552. Further, this field was elaborately explained by William Harvey, who is famous because of dissecting his sister's body to see about the blood circulation. During 1578 to 1657, William Harvey was there, and he is called as the father of modern physiology. Next, please. Yeah, branches of physiology here. It is mainly classified into two: animal physiology and plant physiology. Animal physiology is also called as zoology. Plant physiology is also called as botany. So here, human physiology is a part of zoology, which is having again three types of classification, like human physiology, experimental physiology, hematological physiology, and then clinical physiology. So when we know all these things, clinical implication is possible. So one has to study physiology in detail, then only he can do good practice. That is why one has to study physiology in a better way if you want to become a good clinician or a physician. Next, please. Yes, moving on to the derivation of Sharira. So Sharira means that which is continuously decaying. We'll get the derivation of Sharira as Shiryate Tad Iti Shariram, the one which continuously undergoes decaying process, that is called as Sharira. And further, Sharira is having some other definitions like Sattvatma Shariram cha, Sattva, Atma, Sharira. These all are the basis for Sharira. And Sharira, it includes Sattva, Atma and Mana. These all are the components of Sharira. So this implies the idea of catabolic processes, that is decaying process continuously takes place, which is explained in the form of catabolism. So metabolism is a process which is going on in our body, which is having two types, that is catabolism and anabolism, which indicates continuously transformation takes place in our body. That is how the word Sharira is made. So Sharira is the place for Chetana Dhatu also, or it is also called as Atma, which is also made up of Panch Mahabhuta, that is 5 basic elements, and where all these factors act in a state of equilibrium, that is called as Sharira. So Sharira is having many type of classification like Ekadhatvatmaka Sharira, Shad Dhatvatmaka Purusha, or even Chaturvimshatika Dhatvatmaka. So all these components are there in the Sharira. That is why the Sharira can be classified on the basis of Ekadhatvatmaka, Shad Dhatvatmaka, Chaturvimshatika Dhatvatmaka, and even Panchavimshatika Dhatvatmaka. Next, please. So Sharira is nothing but the combination of dosha, dhatu and mala, which are considered as the basis of Sharira. Doshas here are of two types. Sharira is made up of dosha, dhatu and mala. All of our acharyas, they have explained as dosha, dhatu and mala are the base of the Sharira. Sharira is made up of dosha, dhatu and mala. These are the components which are present in our body. Doshas 3, dhatu 7, malas 3. So totally 13 components are there in our body. Our body is made up of these 13 components. Without these, Sharira is not possible. And if any kind of derangement takes place in this dosha, dhatu and mala, Sharira is going to suffer from various type of diseases. Further, doshas are of two types. That is Sharirika doshas and Manasika doshas. Sharirika doshas are again 3, Vata, Pitta, Kapha. Manasika doshas are Raja and Tama. Although Sattva is also considered as one of the guna for mana, but Sattva is one of the synonym word used for mana. So Sattva here is considered as guna but not dosha. So when Sattva is considered as guna, Raja and Tama are to be considered as doshas of mana. Next, please. So moving on to the definition of Sharira, the structure in which digestion takes place, that is Sharira. Sharira is the one where continuously some or the other thing is going to form. Transformation is continuously going to happen. Conversion of one to the other is continuously going to happen. Transformation, transportation, digestion, metabolism, all these processes are going on continuously in our body. When these processes are continuously going on, it indicates that Sharira is alive, body is alive, life is present in the body. If these processes are not going to happen, then it is considered as the body has been died. There is no further life in the body. So continuously where the changes takes place, continuously where transformation takes place, conversion of one to the other takes place, that is called as Sharira. So metabolism, digestion is also called as metabolism, which is made up of two type of processes, that is catabolism and anabolism. Catabolism is continuously destruction takes place, anabolism is continuously construction takes place. So these two are the combination of metabolism. Metabolism is the process where continuously catabolism as well as anabolism takes place. Catabolism is continuously some cells are going to die. Anabolism is at the same time some new cells are going to generate. So these two type of functions where they are going to happen, that is called as Sharira. Continuously new type of cells are going to generate. At the same time, some cells are going to die. So this type of process will continuously going to happen in our body, which indicates that body is alive. Because in the dead body, these type of movements or these type of functions we are not going to get. So that is how the difference we can make, differentiate we can do, as the living body is continuously processes are going on, and in the dead body these functions are not going to happen. Next slide, please. Yes, in the modern science, the physical structure, including bones, flesh, and organs of a human being, is called as body, and it is the place where soul and other contents are going to place. Dosha, Dhatu, Mala here are the three main roots of the body. That is why it is also called as tripod science, or the study which deals with these three tripods. Tripods here are can be indicated to dosha dhatu mala, or it also can be indicated to only dosha, because doshas are also only three. Dosha dhatu malas are also three components. Like this, tripod science is indicated for Ayurveda, which deals with either dosha dhatu mala or three types of sharirika doshas. So Ayurveda is also called as tripod science, as dosha dhatu malas are the base of the science, or even simply doshas also we can call as a base for the science. So it is called as tripod science. Next, please. Next slide, please. Yes, in the modern science, Sharira Kriya is called as physiology, as it is the study of normal functioning of the body. One who want to study about the physiology, he should study how the functions of the systems they are going to work, like how respiratory process is working, how digestive system is working, how excretory system is working. To study all these systems functions in a detail, it comes under the field of physiology. Physiology deals with the normal functioning of our body, which includes the functioning of normal systems. Many systems are working in our body for healthy status. To maintain the normal functioning of these systems is must. So the living processes of organisms can be studied with the help of underlying chemical, physical changes and structural specialities. To understand the working process of the living body, we can apply the principles of physics, chemistry, and even anatomy. These all are closely related to our science. That is, in these the theories which are told in physics, chemistry, anatomy, that those principles we can apply in the Sharira Kriya, we can apply in Ayurveda for studying them or for understanding them in a more better way. To study the laws or the principles which are told in physics, chemistry, anatomy, like science things, that we need to apply in Ayurveda for getting clear idea, for understanding them in a better way. Next slide, please. Yes, to have a thorough knowledge on the subject, one should be well versed with the above mentioned three basic sciences, like study of circulation of blood or passage of ions across the biological membrane. It comes under biophysics. So if we are good in the physics, that can be applied to the biology, and that type of science is called as biophysics. For example, chemical basic functions, if we want to apply, then it will become biochemistry. And structural peculiarities, what we are going to study, that will come under anatomy. Like this, what in the +2 level, whatever you have studied in the form of principles, in the form of laws, or in the form of principles, applying that in the today's science of Ayurveda will give you more explanation, or you will become more thorough in that specific subject. Because as all of us we know that in Ayurveda we'll get very less explanation regarding anything. So to get more idea about the what our acharyas explained so many years back, to apply them in the today's era, we will get some good information, and we can do good treatment by applying the principles which already we have studied into the Ayurveda. Next, please. Yes, doshadatu malamulam hi shariram. This is a very basic thing explained in our science, which is from Sushruta Sutra, 15th chapter. Dosha, Dhatu, and Mala are the Mula of the Sharira. Mula here is considered as the root. And one simile has been given from by Sushruta here, as the tree, the root of the tree, as roots are healthy, then the tree also will be healthy. In the same way, dosha, dhatu, mala are the root of our body. If these are healthy, then automatically our body also will be healthy. If any kind of impairment happens, imbalance happens in these dosha, dhatu, mala, then definitely sharira will going to suffer from any kind of disease. So these are considered as mula, or the base of our body. So these three are also considered as root for the health, as Ayurveda is based upon these only. So whatever we are going to study in Ayurveda, they all are based upon dosha, dhatu and mala itself. As Sharira is a combination of dosha, dhatu and mala. Doshas, Sharirika doshas again can be classified into two types. That is Sharirika dosha and Manasika dosha. Sharirika doshas are Vata, Pitta, Kapha. Manasika doshas are Raja and Tama. And dhatus are, as all of you know, Rasa, Rakta, Mamsa, Meda, Asti, Majja and Shukra are the 7 dhatus. And malas are 3 number, Mutra, Purusha and Sweda. These are the 3 type of malas. So totally this becomes a combination of 13 components which are present in our body. Doshas 3, dhatus 7 and malas again 3. So totally 13 components make our body. Next please. Yes, moving on to the aim of physiology here, to explore the normal functioning of the living organisms, their principles, regulation and their mechanism. To study all these things is a part of aim of physiology, and of course these functions of the body can be studied with the help of experimental results and chemical findings. Like experimental results are based upon the animal experimentation, and chemical findings are based upon the routine investigations what we are going to follow in our laboratories, like blood examination, urine examination, analysis of blood and urine. Whatever we do, they all comes under chemical findings. And experimental results, they have the application of Ayurveda to the modern on some of the animals which are considered as the experimental animals. uh, Doing some research and coming to one conclusion is a base of experimental result. So the study can be done on the basis of experimental results as well as the chemical findings. So this is the aim of a physiology. Next please. Yes, moving on to some of the basic entities which are explained in the field of physiology, that is cell, tissue, organs and systems. These are the base of physiology, as cell is the structural and functional unit of the body. Our body is made up of very small entities which are called as cell. So there are millions and billions number of cells are present in our body, as it is considered as the structural and functional unit of the body. And I think already you know about the definitions of all these things. Tissue is the one which is a group of cells which do the same kind of function, which perform same kind of function. That is called as tissue. Tissue is a group of cell which perform same kind of function. Again, there are many type of tissues are there in our body, like epithelial tissue, bone and cartilage, muscle tissue, nervous tissue. All these are the type of tissues. And organ is the one which is again a group of tissues which are doing a same kind of function. For example, organs are of two types, like hollow organ and compact organ. So we have so many organs like this based upon hollow and compactness. Then system is the one which is made up of some organs which are going to perform same type of function. For example, next please. Next slide, please. Yeah, these all are the different systems of our body. Hemopoietic system is there, respiratory system is there, GIT is there, that is gastrointestinal tract is there, CVS is there, cardiovascular system is there, excretory system is there, endocrinal system is there, CNS is there, musculoskeletal system is there, and reticuloendothelial system is there. These all are the systems which are going to have a group of organs which are going to do the same kind of function. For example, hemopoietic system, it includes liver, spleen, and some of the organs which are going to produce blood and the blood cells. So it is called as hemopoietic. Poietic means what? Which gives generation, which gives development, which helps for the growth. So hemopoietic system, it also includes bone marrow, liver, and the spleen, because production of blood cells takes place in the bone marrow, and further its destruction takes place in the liver and the spleen. So these all are the part of hemopoietic system. Similarly, respiratory system is having the function of helping in respiration as well as gaseous exchange, where some of the organs are there, like nose is there, trachea is there, these lungs are there. These all are the parts of respiratory system. In the same way, GIT, CVS, excretory, these all are the systems which consist of typical type of organs which are going to perform same kind of function. These all are the organs which will help for this type of function, and without any disturbance for being healthy, all these systems should work properly. Like dosha dhatu mala, I have told, for the normal healthy being, dosha dhatu mala should be in a healthy condition. In the same way, with the help of that dosha dhatu mala, these systems are going to work in a healthy manner, healthy pattern. Then only a man will be healthy. Otherwise, if any disturbance occurs, if any kind of imbalance occurs in that dosha dhatu mala, then that will affect on these systems, and very soon health of a person will be disturbed, and he is going to suffer from various type of diseases. So these vata pitta kapha or dosha dhatu mala are the base which will help for being healthy with the help of these systems. Next please. Yes, scope of physiology. What scope we will have for the studying physiology? Like normal functions we are going to study with the help of physiology, and basic mechanism of life processes which are seen in the form of normalcy. Like normal functions, if we study what happens in the basic mechanism of following those functions, like respiratory system, or I want to take example of digestive system. If that system is working well, then we will be healthy. Not only digestive system, all the other systems, if they are working in a normal way, then a person will be in a normal condition. So if we study normalcy in a better way, then very easily we can notice the imbalance way. When the normalcy will change, then diseases are going to produce. So if one is going to study normalcy of these systems very well, then he can notice how it has become abnormal. When normalcy will disturb, it becomes abnormalcy, leading to the diseases. And study of physiology is also useful in the research purpose, like how these systems are going on, how it is working. Yes, for the research purpose also physiology is useful. We can apply the laws or principles which are explained in the field of physiology to the disease or health condition, and we can search some of the things which is meant for the research purpose. Next please. Next slide. Yes, moving on to the right topic, that is dosha here. Doshas are the factors in the body which pollute themselves and start to pollute certain other factors. This is how the word dosha has been made. Dushayanti iti doshaha. Doshas, when they are in the normal condition, they will produce health. At the same time, when they become abnormal, dushayanti iti doshaha, when they become abnormal, then doshas are going to pollute our body. Dushayanti iti dosha. So the term dosha has been given. Doshas always should be in a normal condition. For being healthy, they should be in normal condition. If by following some of the apatyakara ahara vihara, these doshas will become imbalanced. Either they will become more or they will become less, leading to the imbalance in their functions, and then many of the diseases we are getting. The term dosha means the disturbing factor, and it has got definite physiological importance in the normal state. For being healthy, doshas are having a lot of importance. In the same way, doshas, when they become vitiated, then they are again very essential factor for production of any kind of disease. For the manifestation of any kind of disease, imbalancing of dosha is needed. Otherwise, none of the diseases are going to produce. So doshas are having a major role in the manifestation of disease as well as in the maintenance of health. So dosha has been considered as an important factor for the formation and maintenance of the body. Normal functioning of the dosha, it produces health of the body, whereas abnormal status of the dosha is responsible factor for the production of the disease. So here what happened, for the maintenance of health as well as for the manifestation of disease, for these both conditions, doshas are the essential factors. Doshas are the etiological factors which will produce health as well as disease. For these two things also, doshas are having its own role, because doshas are considered as the most important one than that of the dhatus and the malas. So doshas singly are a responsible factor to produce any kind of disease, not dhatus and malas. Doshas, when they become imbalanced, they can cause any kind of diseases independently. But dhatus and malas, they cannot cause any kind of diseases such independently, because dosha here is the prime factor, and dosha is the one which pollutes other entities of our body also. Next slide, please. Yes, beside the Sharirika dosha, there are two types of Manasika dosha. Already we have discussed, which will affect the mental state of the individual. Mind will be disturbed by these two types of doshas, that is Raja and Tama. Accordingly, they produces the diseases of psychic origin. Many of the Manasika Vyadhis nowadays has become very burning problem, where nowadays mind is not in a proper way because of stress, because of not following proper diet, and using most of these things such as TV, mobile, computer. These all will lead to much stress on the mind, and by that many of the manasika vyadhis we are getting, which is where the origin is related to mind. So disorders such as desire, anger, greed, delusions, envy, arrogance, fear, complex, jealous, anxiety, etc. These all are the conditions related to mind, where our mind is not healthy. When it becomes vitiated with raja or tama, then many of the manasika vyadhis we are getting. How raja and tama will vitiate? Because of nowadays situation. Food, what we are going to take, it is going to imbalance manasika dosha. Like it may increase raja or it may increase tama. So both of the conditions will lead to manasika vyadhis. Manasika vyadhis very commonly we are getting today in the younger generation, because of not giving any kind of exercise to the mind, to the body. Then automatically sitting at a place and involving in a work, uh, automatically raja and tama will be disturbed, leading to all these disorders such as desires will increase, anger, very soon they'll get anger, greediness will be more, and envy, arrogance. These all conditions we are getting very soon in a younger generation, because of the derangement in the raja and tama. And this will happen by consuming food which is unhealthy, which will increase raja and tama. Consumption of such type of food, like junk foods are there, roadside foods are there, they all will increase raja and tama, leading to many kind of mental disorders. Okay, next slide please. So in the psychic disorders, first of all, the mind will be affected. Further on, its effect we are getting on the body also. In manasika vyadhis, initially mind will be affected, and the effect of that is seen on body also, sharira also. So again, manasika vyadhis are also going to form. In the same way, if in the sharirika vyadhis are there, the effect of that sharirika vyadhis is seen on mana again, and psychic disease are also seen. Like this, Sharira and Mana are related to each other. Sharira and Mana are like this. They one will affect on the other. Initially, if Sharirika Vyadhis will be there, they are going to affect on Mana. If am I audible now? Sri Lakshmi? I'm audible now?
Yes, ma'am, you are.
Okay. Shall I continue?
Yes, ma'am, please.
Okay. Okay. Like this, mind and body are related to each other. The disorders of mind will affect the body. Disorders of body will affect the mind. So initially, psychic disorders will be seen that will affect on the body, and many kind of sharirika vyadhis are also we are getting. In the same way, if sharira is affected, disorders we will get, the same will be affected on the mind. Like this, sharira and mana are related to each other. Thus, the causative factor of psychic disorder should be avoided to check the further development of the somatic disease. Somatic diseases will produce by the effect of psych or mana. If mana is affected, it will lead to many kind of somatic disease. In the same way, if any kind of manasika, sharirika vyadhis are there, they are going to affect the psych or mana. So like this, sharira and mana are related to each other. Next slide, please. Yes, thus the balance of both Sharirika and Manasika doshas is the state of normalcy, that is the health, whereas the imbalance of both above doshas is the state of disorder, that is diseased condition. When Vata, Pitta, Kapha as well as Raja and Tama are in a normal state, it will give health. The any kind of imbalance of Vata, Pitta, Kapha as well as Raja, Tama will lead to either Sharirika Vyadhis or Manasika Vyadhis. So for being healthy, doshas should be kept in an equilibrium state by consuming healthy food, by following healthy diet. So if you follow Patyakara Ahara Vihara, then all these doshas will be in a state of equilibrium and automatically health will be maintained. Whereas if you consume unhealthy food, if you follow unhealthy diet, then Sharirika doshas as well as Manasika doshas will become abnormal, leading to disease condition, either Sharirika Vyadhis or Manasika Vyadhis. Both of them are harmful to the body itself. Although there is an involvement of mana in Manasika Vyadhis that also affect the body. Like this, Sharira and Mana are linked to each other. So to be healthy, one has to follow healthy diet. Next slide, please. Yes, this is a picture of Tridosha, which includes Vata, Pitta and Kapha. Among these three also, Vata is having its own importance when compared to Pitta and Kapha. Vata is helpful for doing all kind of movement, all kind of functions, whereas Pitta is required for the conversion of one to the other, transformation of one to the other, metabolism of one to the other. For anything, any kind of change to takes place, Pitta is required, and Kapha is the one which will give stability to the body. That is the definition of Vata, Pitta and Kapha. Next slide, please. Yes, these are 7 dhatus: Rasa, Rakta, Mamsa, Meda, Asti, Majja and Shukra. So Rasa is Jaliya dhatu, which gives nourishment to the body. Rakta is the one which gives life to the body. Mamsa is the one which gives stability to the body. Meda is the one which is acting here as a adipose tissue and also which gives constancy to the body. Asti is the one which gives proper shape and structure to the body. Majja is again liquid in nature, which helps for the further utpatti of Shukra dhatu, and it is present inside the Asti. Shukra is considered here as a reproductive tissue, which is helpful for the process of reproduction to happen. Next slide, please. So, Mutra, Mala are 3 number: Mutra, Purisha and Sweda. Although Malas here, Malas next, previous one. Yeah, Malas can be classified into 2 types as Brahat Mala and Kshudra Mala. Brahat Malas are the one which are produced more in quantity, like Mutra, Purisha and Sweda are the Brahat Malas. Kshudra Malas are the one which are produced in a small quantity, such as Dhatu Malas. Dhatu Malas are produced in a very less quantity from during the production of dhatus. These Dhatu Malas are going to form. Like this, Malas are classified into 2 types. Next slide, please. Yes, doshas here, there are 2 stages for the doshas, that is Avikrita dosha and Vikrita dosha. Avikrita doshas are the one which are helpful for the body. Avikrita, which are not disturbed, which are in a normalcy, which are in Prakrita avastha. Avikrita is also considered as Prakrita avastha. Doshas which are in Prakrita avastha, they are helpful for supporting the body, that will give health to the body. Whereas Vikrita dosha is the one, doshas which have changed their normalcy and they have become abnormalcy. Such doshas are responsible for the production of disease as well as for destroying the body. So these are the 2 stages of doshas. Doshas are having these 2 stages like Avikrita and Vikrita. Vikrita is the one which is imbalanced. Avikrita is the one which is balanced. So always one has to take care that doshas should be in a normalcy. They should balance the body by supporting our body. And Vikrita avastha is the one which is meant for the production of disease, manifestation of disease. Once we get the disease, body will be disturbed by such diseased condition, and one day body also will destroy by the diseased condition. So always we should take care that doshas should be in avikrita avastha. They should not disturb. They should be in a balanced one. Then only health status is maintained. Otherwise, we will suffer from the diseases. Next slide, please. Yes, dosha sthana. Here it is mentioned as from Ashtanga Hridaya, the shloka is actually the font is not opening. The dosha sthana mentioned is according to Ashtanga Hridaya Samhita is our body is classified into three types. Our body is divided into three types, like initial upper one, middle one, and a lower one. Upper one is meant for kapha, middle one is meant for vata, lower one is meant for vata. So like this, the dosha sthanas are mentioned in our body like urdhva, madhya, and other. Urdhva sthana is for kapha, madhya sthana is for pitta, adho sthana is for vata. So as during the digestion process go on, according to the ahara paka, if you know about avastha paka, initially formed dosha is kapha, which the utpatti of kapha takes place at the initial stage of avastha paka. Because of that reason, the place for kapha is told as the upper part of our body, such as ura bhaga or the chest region here is the place for kapha. The middle one where amashaya comes, that is stomach comes, that is the place for pitta. At the place of nabi region, umbilical region, exactly umbilicus, it arises middle part of the body. So that is considered as the place for pitta, and lower to that nabi is the place for vata. So that is considered as the place for vata, as the utpatti of vata takes place at the last stage when the process of digestion go on, like avastha paka. If we can see, in the first stage kapha will originate, in the second stage pitta will originate, in the third stage vata will originate. So the places are also mentioned in the same way, like upper part is for kapha, middle part is for pitta, and lower part is for vata. When we look into the location in detail, next slide please. Next slide please. Yes, according to various acharyas, it is told that vata is located in the basti, pakvashaya, kati, sakti, pada, asti, all those things. So according to charaka it is, and pitta is located in sweda, rasa, lasika, rudira, and amashaya. The places for kapha is mentioned as ura, shira, griva, parva, amashaya, and meda. According to Sushruta, the places for vata are told as Shroni, Guda, and Pakwadana, and for Pitta it is explained as Adho Nabi, Pakvamashaya Madhyaga, Yakrit, Pliha, Hrudaya, Drishti, and Twak. And according to Kapha is located in the Ura, Shira, Kanta, Jiva Mula, Sandhi, and Amashaya are the places for Kapha. According to Ashtanga Hridaya, Pakvashaya Kati Sakti, Shrotrasti Sparshanendriyam, Sthanam Vatase Tatrapi, Pakvadanam Visheshataha has been told. Although many places are explained for Vata, then also Pakvashaya is considered as the special site for Vata. Vata is specially located in the Pakvashaya. Although the places or these regions are considered as the where the vacancy is, so that empty place is filled by Vata. Among them also, Pakvashaya is considered as main site for Vata. And Pitta here, the place for Pitta is mentioned as Nabi Ramashaya Svedo, Lasika Rudiram Rasa, Drik Sparshanam Cha, Pittasya Nabiratra Visheshata. Although these all places, locations are mentioned for Pitta, then also Nabi is considered as the specific site for Pitta. Because Nabi region is the place mentioned for Grahani or Lagvantra, that is the specific site for Pitta. So here Nabi here is considered as the place. Somebody's mic is unmuted. Yes.
Sorry, ma'am, you can continue.
Yeah. Pitta here is the specific site for Nabi is the specific site for Pitta. In the same way, Urakanta Shirokloma, Parvani Amashayurasaha, Medo Granam Cha Jivacha, Kafasya Sutaram Uraha. Urabhaga, that is chest region, is considered as the specific site for Kapha according to Ashtanga Hridaya. So we will discuss why these specific sites are told for three doshas in the later slides. Next, please. Yes, moving on to gunas of Vata here. Tatra ruksha lagu shita, khara sukshma chalo anilaha. Vata is having the gunas of roughness, lightness, cool, and khara, that is khara is not having soft edge, sukshma is subtle, chala is mobile, vishada is non-slimy. Vata guna is specific gunas of vata here are lagu, chala, and khara. These are the specific gunas of vata. Whenever vata becomes aggravated, there is increase in all these gunas of our body. Body will become dry, chalata, mobility will become more, and the body will become more cool when vata increases in our body. When vata increases, these gunas of vata also will increase, leading to the diseased condition or some of the symptoms of vata vriddhi we will get, which are related to these gunas. So the purpose of studying gunas of three doshas is this, like further when we get any kind of symptoms, we can correlate those symptoms with these gunas and better treatment can be done. Because of doing better treatment only, we need to study gunas of three dosha, karmas of three dosha, and sthanas of three dosha. When we know all these things, treatment procedure can be done easily. Next, please. Yes, moving on to Pitta gunas. Pitta is having gunas like Snigdha, Tikshnoshna, Lagu, Sara, Drava, and Amla. Pitta always in liquid in nature. It is oily. It is sharp, like very sharply the movement is seen, and it is hot always. It is also light. It is Sara, fluid, Drava, liquid, and it is Amla or sour in taste. When Pitta guna increases, these gunas we are going to get increased in our body. Like snigdhata will become more, tikshna guna will become more, ushnata in our body will increase. In the same way, if pitta becomes decreased, these gunas are also decreased. On the basis of that, we can assume whether which kind of dosha has been increased with the help of which kind of gunas. Opposite treatment we can do, and again we want to do treatment as normalcy should be established to be free from the diseased condition. Next, please. Yeah, moving on to Kapha gunas here. Kapha is Guru, Shita, Rudu, Snigdha, Madhura, Sthira, and Pichila. It is heavy in nature, it is cool in nature, and it is soft, it is oiliness. Oiliness is present in it, and it is having Madhura Rasa, Sthira, and Pichilata is present. That is, sliminess is a specific quality mentioned for Kapha. As well as Kapha is also having Guru Guna and Shita Guna. These are the main gunas, main characters present in the kapha. In a similarly, like kapha changes, kapha imbalance takes place, there will be imbalance in these gunas also. Next, please. Yes, moving on to vata karma here. Our acharyas have explained very nicely. Utsaha uchvasa nichvasa cheshta vega pravartanai samyak gatya cha dhatunam akshinam patavenacha. Vata is having functions like uchvasa and nishvasa. These are the two stages of respiration. Inspiration and expiration are the two stages of respiration. For these both functions, vata is helpful, and vata also gives utsaha or enthusiasm. Cheshta, as vata is initiator, vata gives stimulation, vata initiates us to do all of the functions. So vata here, the karma of vata is considered as giving cheshta. And vega pravartana, for any kind of evacuation, for any kind of excretion, vata is helpful. And for gati or the movement, vata is needed. If we want to move from one place to other without vata, it is not possible. And even blinking of eyes is told as the example, like for the gati. Any kind of gati, vata is needed. Without vata, nothing gati can be done. So vata here is indicated as for all these functions, vata is required. Well, if any vitiation takes place in vata, there will be imbalance in these karmas. Next, please. Yes, pitta karma here is pittam paktyushma darshanai kshutrut ruchi prabha medadi shaurya tanumardavaihi. These are the karmas of pitta. Like pakti is the digestion. As for the digestion, ushma is needed, heat is needed, agni is needed. Without agni or without heat, digestion is not possible, as digestion can be considered as the process of change, process of transformation, process of conversion of one to the other. That is the process of digestion. So without pitta, without ushna guna, Without Agni, this process is not possible. So according to Sushruta, it is told that Pitta and Agni are one and the same. Agni is present in our body, which is helpful for the process of digestion. That Agni is Pitta itself. Pitta is Agni. Pitta and Agni are one and the same. There is no any differentiation between Pitta and Agni according to Sushruta. But what Charaka opines is Pitta and Agni both are different. Both are not same. Although Agni is present in the Pitta because of its Ushna Guna, but they both are not same. They both are different. But Sushruta tells that, Sushruta opines that Pitta and Agni are one and the same. So Pitta helps for the digestion. It gives heat to the body. It helps for the appetite and thirst to happen, and it gives luster to the face. For intelligence or meda, Pitta is needed. For shaurya or braveness, and for softness of the body, Pitta is very essential. Without Pitta, these all functions are not possible. When we apply the gunas of Pitta, we can see these karmas to happen with the help of gunas of Pitta, which already we have seen in the previous slides. So Pitta gunas are helpful in the functions of Pitta, like Pitta is Drava in nature, Pitta is Ushna in nature, Pitta is Sara in nature. They all can be applied here in the karmas of Pitta. Already I have told, when you start applying one into the other, you can understand in a more better way. That is why we need to apply the gunas of Tridoshas, karmas of Tridosha, and karmas in the Vriddhi and Kshaya Lakshanas of Tridoshas. Like this, if we start studying, we can understand in a more better way, and because of which treatment can be done in a more better way. Next slide, please. Yeah, moving on to Kapha karma here. Kapha, it gives Stiratva, Snigdhatva, Sandibandha, Kshamadibhihi. Kapha gives sthirata to the body, stiffness to the body. Snigdhata is produced because of kapha, as well as pitta is also producing snigdhata. And Sandibandha, it helps for the proper joints to for proper movements of the joints, as one joint and one joint is connected with the other joint with the help of kapha. And kapha is also having the function of kshama, which is indicated for mana here. Like kapha karma, it makes broad minded by applying one quality of forgiveness. Like in kapha prakriti person, we can see this kshama quality we are getting in the kaphaja prakriti, as it is one of the function of kapha. These all are the functions of kapha. If any kind of imbalance happens in the kapha, these functions also will disturb. On the basis of these disturbed functions, we can assume again what kind of dosha has is imbalanced. Next slide, please. Yeah, moving on to, up to now we have studied the normal condition. So that normal condition will be disturbed either by increase or decrease state of dosha. So imbalanced state of dosha can have following two features, such as either it may decrease when the dosha decreases, the normal functions also will decrease, leading to kshaya of the dosha. In the same way, any kind of increased state of normal function is there, it will lead to vriddhi of the dosha. The functions will become more, leading to vriddhi, or sometimes the functions will become less, leading to kshaya of the doshas. So these two are opposite state of the normal function due to the deranged state of dosha. And initially, both of these conditions may not lead to disease. Initially, only signs and symptoms will develop. If we treat at the same time without making delay, we can prevent further coming disease. Or otherwise, if we don't start our treatment in these conditions, disease will become more, and that time treating it may be little difficult. Otherwise, if we start treating in the initial condition where vriddhi kshaya lakshanas only, we can diagnose and we can do the treatment very easily. When we make delay, and these lakshanas will convert into these lakshanas will convert into disease, then treating that will be little bit difficult. Next slide, please. Yes, vata vriddhi, if it happens, it will lead to karsha kashnoshna kamitva kampana anaha shakrudgran Bala Nidrendriya Brahmsha, Pralapa Brahmadinata. These all are the futures which will develop because of Vata Vriddhi. When Vata Vriddhi happens, it will lead to Karsha, emaciation or leanness of the body is seen. Karshna, body converts into blackish discoloration is seen over the body. Ushna Kamitva, person feels desire for taking or having hot things. And Kampa, tremors are seen. Anaha is the distension of abdomen is seen. Shakrit Graha, constipation is seen. Bala Brahmsha and Nidra Brahmsha leads to, means loss of strength and loss of sleep. Indriya Brahmsha takes place, that is loss of sensory functions takes place. Pralapa, person will be involved in irrelevant speech. Brahma, giddiness happens. Dinata means face will become very like very small, like with full of pain, like that. Luster of the face will be lost, leading to deenata of the face. So these all are the lakshanas of vata vriddhi. In this condition, we need to make vata kshaya, where vata has become more. We have to do the treatment wherein increased vata should come back to the in decreased condition, leading to normalcy, not too less, but for maintaining normalcy should be our aim. So when vata vriddhi takes place, we need to give certain treatment by which vata becomes kshaya, leading to normalcy, and again healthy status has to be maintained. Next slide, please. Yes, pitta vriddhi leads to pitte mando analaha. Pitta vriddhi leads to pita basata kshutrut dahalpa nidrata pittam. Pitta vriddhi leads to Pita basata, discoloration, yellowish discoloration of the body is seen. When pitta becomes more in our body, it leads to yellowish discoloration of the body. Kshuddha and Trishna will be in increased condition, as increased appetite and increased thirst will be there. Daha will be there, that is burning sensation is seen, as well as Alpa Nidrata is seen. These all are the symptoms where we can see Pitta Vriddhi. Pitta Vriddhi will be seen when all these symptoms we can see. Next, please. Moving on to Kapha Vriddhi. Kapha Vriddhi, when it takes place, it leads to Shwaitya Shaitya Shratangatvam Shwasakasati Nidrata. Shwaitya is whitishness of the body. Shaitya, coldness of the body. Shlata Angatva, looseness of the body parts. Shwasa Kasa, that is Shwasa is breathlessness, Kasa is cough, and Ati Nidrata is seen. Excessive sleep is seen. When you want to apply gunas of kapha, we can easily understand these lakshanas. Like gunas of kapha are, it is guru in nature, it is shita in nature. So guru guna, when increases in our body, it leads to shlata angatva, and when coldness of the kapha increases, it leads to shaitya and shwaitya. Shwasa and kasa are the symptoms wherein which are the symptoms related to kapha vriddhi, and ati nidra is seen. And most important, person becomes alasya, and guruta of the body is seen when kapha vriddhi takes place, as these all are the gunas explained for kapha. Next slide, please. Yes, moving on to vatakshaya. Vatakshaya, if it takes place, it leads to angasada, alpa bhashite hitam samnya moha tata shleshma vriddhi yuktamaya sambhavaha. Angasada, that is pain in the body is seen. Alpa bhashite hitam, person is involved in very less speech, as opposite to this guna we have seen in vata vriddhi, where person becomes pralapa, irrelevant speech will be seen there in vata vriddhi, and very less speech we can get in vata kshaya. Sautnya and moha, that is loss of sensation and loss of consciousness is seen when vata kshaya takes place. And shleshma vriddhi, the symptoms wherein kapha vriddhi takes place, the same type of symptoms we are getting here in the vata kshaya. All the symptoms which are seen in increased kapha, they all are seen even in the vata kshaya. Next slide, please. So pitta kshaya, it leads to pitte pittam mande analaha shitam prabhahani. Manda anala, digestion power becomes less because of pitta kshaya. Ushna guna will become less, as the guna of pitta is ushna. That ushna guna, if it becomes less, it leads to manda anala, mandagni will be seen. Digestive capacity will become less, and shita, body becomes shita, cold, and prabhahani, loss of luster, loss of luster on the face is seen. These all are the lakshanas of Pitta Kshaya. When Pitta Vriddhi takes place, luster increases, luster of the body will increase. As Prabha is one of the guna of Pitta, that will increase if Pitta Vriddhi takes place. That will become less if Pitta Kshaya takes place. Next slide, please. So Kapha Kshaya leads to Brahma Shleshma Shayanam Shunyatvam Rudrava Shlata Sandita. Brahma is seen, giddiness is seen, Shleshma Shayanam Shunyatvam, emptiness of the body parts is seen, Rudrava is pain in the chest region is seen, Shlata Sandita, looseness of the joints are seen. These all are the lakshanas explained for Kapha Kshaya. As guna of Kapha is guru in nature, guna of Kapha is guru, that guru guna will become lost, leading to all these lakshanas like giddiness, emptiness, pain in chest region, looseness of the joints. These all are the symptoms seen during Kapha Kshaya. Next slide, please. Yes, moving on to the Chikitsa aspect here. If there is a derangement in the Vata, the drug, Dravya, what we are going to use is Taila. And in Pitta, Grita is advisable. In Kapha, Madhu is advisable. So these are the drugs of choice which should be given for bringing back the balance which is happened for Vata, Pitta, Kapha. For Vata, Taila is explained. For Pitta, Grita is explained. For Kapha, Madhu is explained. And among Panchakarmas, that is Vamana, Virechana, Basti and Nasya, Niruva and Anvasana Basti. Among Panchakarmas, Basti is a choice of treatment for Vata. Virechana is a choice of treatment for Pitta. Vamana is the treatment for Kapha. As initially we have discussed about the locations of Vata, Pitta, Kapha. Vata is located at the lower part. Pitta is located in the middle part. Kapha is located in the upper part. So Vamana is the therapy given to Kapha, which is helpful for Kapha to come out, which is disturbed. In the same way, the location of Pitta is Nabi region or in the middle part of the body. So from that Virechana route, aggravated Pitta can come outside, and Vata is located at the lower side, that is in the Pakvashaya. So as the Basti is the relevant treatment for Vata. That is why the locations of three doshas are told by our Acharyas for making its use in the Chikitsa aspect. Vata, Pitta, Kapha, three doshas, when they get imbalanced, then proper treatment has to be done with the help of Basti, Virechana and Vamana. So with the help of these three treatment modalities, Vata, Pitta, Kapha can be brought back to the normalcy, so that health has to be recovered. Next slide, please. Yes, moving on to 5 types of Vata. Pranadi Vedat Panchatma Vayu. Vayu is made up of 5 types like Prana, Udana, Samana, Vyana, Apana, Sa, Panchada. These are 5 types of Vata explained by our Acharyas. As already we have seen, the functions of Vata is to stimulate for, or is to give initiation, is the function of Vata. For any kind of gati, for any kind of movement, Vata is responsible. So all these 5 types of Vata is responsible for giving gati in one or the either system. These all are involved. Next slide, please. So Pranotra Murdaga, Urakanta Charobuddhi, Videndriya Chittadrik, Stevana Kshautudgara, Nishwasanna Praveshkrut. According to Ashtanga Hridaya Sutrasthana 12th chapter, Pranavata is explained as the Vata which is located in the upper part, that is in the head region. Pranavata is located, and it is going to move from Ura, Kanta and Buddhi, Hridayendriya, Chittadrik. It helps for the proper functioning of Buddhi, Hridaya, Indriya and Chitta and Drik. These all functions are happening with the help of Pranavata. So it is also involved in functions like Stivana, Kshavatu, Udgara, Nishwasa and Anna Praveshakrit. Stivana, that is spitting. Kshavatu, that is sneezing. Udgara is belching. Nihishwasa, that is respiration process. And for Anna Praveshakrit, for the movement of Anna inside the body. These all are the functions explained for Pranavata. These all are the functions which are explained for Pranavata. The same thing is explained by Charaka Chikitsa as well as Sushruta Nidanasthana also. The functions of Pranavata are explained as the Vata which is helpful for the movement at the upper side. Vaktra Sanchari, the Vata which is moving inside the mouth region, inside the head region, that is called as pranavata. The function of pranavata here is very important function is told, that is respiration process. Pranavata is nothing but vata, what we are going to take inside. And only by Sharangadhara Samhita, in Sharangadhara Samhita, we get explanation of respiration in Ayurveda, that is with the help of Nabhistha Pranapavana. That Pranapavana is the one which is useful for the process of respiration. Next, please. Next slide, please. Yes, Udanavata is the one. Unnayanatad Udana. Udanavata is the one which is having movement to travel in the upper direction. That is, for the process of speech, Udanavata is needed. So speech in Ayurveda is also explained in a very short way, that is with the help of Udanavata. Udanavata is the one which is having movement in the upper direction, and it is the supermost among all other vatas. So it is called as Mahavata. Udanavata is having a synonym as Mahavata, which is considered as very important among all the other vatas. Next, please. Next slide, please. Yes. Urasthanam udanasya nasana bigalancharet vak pravruti prayatnorja balavarna smritikriya. Urasthana here is considered as the place for Udanavata, and it can move from Nasa, Nabi and Gala, and it provides Vak Pravrutti. Vak Pravrutti is done with the help of Udanavata. Along with Vak Pravrutti, it also gives Urja, that is strength, Bala, Varna and Smritikriya. So for all these functions which are happening in the upper part of the body, head region is considered as the place for all these things to happen. So Udanavata is located in the Urasthana as well as in the head region. These are the locations considered for Udanavata. Next slide, please. Yes, moving on to Samanavata. Samanavata, which is located exactly in the Nabi region, it stimulates digestive fire, it gives strength to the digestion capacity by locating in the middle part of the body where Grahani is located. As Grahani is the place for digestion, Samanavata place here is the Grahani, and Samanavata is the one which stimulates Jataragni. Next, please. Next slide, please. Yes, Samano Agni Samipastha, Koshte Charati Sarvata, Annam Grannati Pachati Vivechayati Muchati. For the digestion process to happen, Samanavata is essential. Samana Agni is the one, Samanavata is the one which is located in the Koshta and which is going to move from one place to other in the Koshta. And the main function of this Samanavata is to stimulate the Jataragni, which will help for Annam Grannati Pachati Vivechayati Muchati, for the functioning of Grahana, Pachana and Vivechana and Munchana. These all functions takes place with the help of Samanavata, with the help of Jataragni. The main function of Samanavata is to stimulate the Jataragni, and with the help of which all these functions will happen. Next, please. Next slide, please. Yes, moving on to Vyanavata. Deham Vyapnoti Sarvam tu Vyanaha. Vyanavata is the one which is spread all over the body, and Vyanavata is helpful for the proper circulation all over the body. Next slide, please. The function of Vyanavata here is, Vyanavata is Deham Vyapnoti Sarvam tu Vyanaha Shigra Gati Naram Gati Prasaranakshepa Nimeshanadi Kriya Sada. So Gati here is the specific function of Vyanavata. As Vyanavata is involved in the circulation of rasa, Vyanena Rasadaturi Vikshepochita Karmana Yugapat Sarvato Jastram Dehe Vikshipete Sada. Always, all the 24 hours, movement of Rasadhatu takes place all over the body. That is with the help of Vyanavata. As Vyanavata is spread all over the body, it helps for the continuous movement, continuous circulation of Rasadhatu all over the body. Next, please. Yes, next one. Next one. Yes, Apanavata is the one which is meant for Apana indicates lower part. So Apanavata is located in the lower part of the body, that is in the Pakvashaya. Large intestine is the place for Apanavata. Maladinam Adho Nayanat, the one which helps for the movement of the fecal matter at the lower part, that is called as Apanavata. Next one. Apanavata is the one. Apanopanaga Shroni Basti Medro Gochara Shukrartava Shakramutra Garbanishkramana Kriya. Apana is located at the lower part of the body, that is in Shroni, Basti, Medra and Uru. These are the locations for Apanavata, and the function of which is Shukrartava Shakrat Mutra Garbanishkramana Kriya, for the evacuation of Shukra, Artava, Shakrat, Mutra and Garbha. For evacuation, for excretion of all these things, Apanavata is responsible. Next, please. Next, please. Yes, this I have summarized. Pranavata, its chief location is Shira Pradesha, and it is having extension in chest, neck, etc. Its main function is in Shvasa Prakriya. Udanavata is located in Ura Pradesha. It is having movement in nose, umbilicus and neck region. Its main function is Vak Pravrutti. Similarly, Dhyanavata is the one which is located in Hridaya and which is having movement in entire the body. Gati here is the main function of Dhyanavata. Samanavata is the one which is located in Koshta and it is having movement in whole of the GIT. Its function is to help in the Pachana Karma. Apanavata is the one which is located in the Adhonabi and which can move in pelvis, bladder, penis, thigh, etc. Its function is Nishkasana or excretion or evacuation of the waste materials. Next slide, please. Yes, moving on to 5 types of Pitta. Pitta types are Pachaka, Ranjaka, Alochaka, Brajaka and Sadhaka. So among these 5 types, Pachaka Pitta is considered as most important. When we look into the function of Pachaka Pitta, it is essential for the function of Pachana. So it is considered as the main Pitta. Next, please. Next slide, please. Pachaka Pitta is having the capacity to digest Ashita, Pita, Lida, Khadita, Ahara Jatam Jatavirya, Pachayati iti Pachaka, the one which digests whatever the food content is, as Ahara Dravyas are of 4 types: Ashita, Pita, Lida and Khadita. These are based upon the uses. Ahara is classified like this into 4 types. So whatever the food you are going to take, that will help with the help of Pachaka Pitta. The one which digests, that is called as Pachaka. Next, please. Next slide, please. So, very important shloka here. Tatra Pakvamashaya Madhyagam. The Pitta which is located in between Pakvashaya and Amashaya, that is Pachaka Pitta. And Panchabhutatmakatve api Yattejasa Gunadayat. Although it is made up of all Panchamahabhutas, it is having a dominancy of Teja Mahabhuta. Tyakta Dravatvam Pakadi Karmana Anala Shabditam. It is devoid of Dravata, although it does the function of Paka, etc. Karma, with as Anala Shabda is more suitable to here to Pachaka Pitta. Pachatyanyam Vibhajate Sarakito Pritaktata. After making digestion, it separates Sara and Kritta. Tatrastameva Pittanam Sheshanam api Anugram. It also nourishes, it also gives proper nourishment to remaining type of Pittas also. Karoti Baladanena Pachakam Nama Tasmutam. It also gives Bala. That is why it is called as Pachaka. The name Pachaka is more suitable as it is involved in all of these functions. Next slide, please. Next, please. Next, please. Yes, moving on to Ranjaka Pitta here. Yattu Yakrit Pliho Pittam Tasmin Ranjaka Ugniti Samdhya. The Pitta which is located in Yakrit and Pliha, that is called as Ranjaka Agni according to Sushruta. Already I have told, according to Sushruta, there is no difference between Agni and Pitta. Sushruta opines that Pitta and Agni are one and the same. So while explaining types of Pitta, he has used the word Agni itself, like Pachaka Agni, Ranjaka Agni, Sadhaka Agni. Wherever types of Pitta are, he explains that he explains with the help of Agni itself, as according to Sushruta, there is no difference between Pitta and Agni. So the Pitta which is located in Amashaya, Amashayashrayam Pittam Ranjakam Rasaranjana. Pitta which is located in Amashaya and which is a responsible factor for making Rasaranjana, that is called as Ranjaka Pitta. According to Sushruta, the place for Ranjaka Pitta is Yakrit and Pliha. According to Ashtanga, the place for Ranjaka Pitta here is Amashaya. Pitta which is located in Amashaya and which does Rasa Ranjana, that is called as Ranjaka Pitta. Again, we can correlate this with the modern aspect that Ranjaka Pitta here is considered as the intrinsic factor of Castle, which is located in the stomach region, which is again helpful for the process of erythropoiesis. That factor we can consider here as a Ranjaka Pitta. And according to Sushruta also we can apply the same thing. Yakrit and Pliha here are the two organs which will help for the process of erythropoiesis. Like some of the hormones they are going to produce, which are helpful for the process of erythropoiesis to happen. So Ranjaka Pitta we can apply like this. Next please. Next slide please. Next please. Yes, Alochaka Pitta yat drishtyam pittam tasmin alochako agni iti samnya sa rupa granadi krita. According to Sushruta, in the drishti, the pitta, in the eyes, the pitta which is located, that is called as Alochaka Pitta. And according to Sushruta, it is Alochaka Agni, but according to other acharyas, it is Alochaka Pitta. Rupa Lochanata Smrutam Drikstam Alochakam. The pitta which is located in the eyes and which is essential for the function of vision, that is called as Alochaka Pitta, according to Ashtanga Hridaya as well as according to Charaka. Next please. Next please. Yes, Brajaka Pitta yattu tvachi pittam tasmin brajakogni iti sabdya. According to Sushruta, the pitta which is located in the tvacha, that is called as Brajaka Agni, and that is responsible for Abhyanga Parisheka Avagaha Lepanadinam Kriyadravyanam Pakta Chayanam cha Prakashaka. The pitta which is responsible for the absorption of Abhyanga Parisheka Avagaha Lepana, whatever functions, whatever processes we are going to do on the skin, the absorption of all those applied aspect is done by Brajaka Pitta. And Chayanam cha Prakashaka, it is also helps for the shining of the skin. It gives a proper chaya, or it helps for the shining of the skin. That is Brajaka Pitta. Next slide, please. Next one. Yes, according to Ashtanga Hridaya, it is told that Tvakstam Tvacho Prajanat Brajakam, the pitta which is located on the Tvacha and which makes Brajana of the skin, that is called as Brajaka Pitta, which gives luster to the skin and which is responsible for the complexion of the skin and which also regulates the body heat, that is called as Brajaka Pitta. Next please. Next please. Yes, moving on to Sadhaka Pitta. It is located in the Hridaya. Sadhakam Vrudgatam Pittam. Hridayastam Buddhi Medabhimana Utsaha Abhipretartha Sadhanat Sadhakam. If we decide something to do, that is done with the help of Sadhaka Pitta, as Hridaya is the place for Sadhaka Pitta. So it is done by Sadhaka Pitta, which is located in the Hridaya. Next please. Yes, this is the summary of Pitta, 5 types of Pitta, where they are located and what is their main function. Next slide, please. Moving on to the types of Kapha here. Avalambaka, Kledaka, Bodhaka, Tarpaka, Shleshakatva, Bedaihi, Shleshma. Kapha are of 5 types, like Avalambaka, Kledaka, Bodhaka, Tarpaka, and Shleshaka. Next slide, please. So Bodhaka Kapha is the one which is located in the oral cavity, Mukha Kuhara. Jivha Mula Kantasto Jivendriyasya Saumyatvat Samyak Rasadhyane Vartate. The one which is responsible for the perception of taste is called as Bodhaka Kapha. Rasanasta Samyak Rasabodhanat Bodhakaha. The one which is located in the Rasana, that is in the tongue, and which is meant for Bodhanat, Bodhana of Rasa, that is called as Bodhaka Kapha. Perception of taste occurs in the mouth cavity, that is with the help of Bodhaka Kapha, which is located there in the form of saliva. Next slide, please. Next one. Next. Yeah. Avalambaka Kapha here is the one. Urastaha Trik Sandaranam Atma Virena Annarasa Sahitena Hridaya Avalambanam Karoti. Avalambaka Kapha, it is located in the chest region and it helps for the proper functioning, or which contains Annarasa, and this Kapha, it looks after Trik also. Hridaya Avalambanam Karoti. Next slide, please. Yes, Urastaha Satrikasya, previous one. Previous. Yes, Urastha Satrikasya Swaviryataha Hridaya Sanya Viryacha Tatstha ततस्थ एवामु कर्मणा कफदाम्नां च शेषाणां यत् करोत्यवलम्बनम् अतो अवलम्बकः श्लेष्मा. So Trika region is explained here as the place for avalambaka kapha according to Ashtanga Hridaya. It has been commented by the commentator like, next slide please. Trika, the place is, Trika is the one which is the combination of three parts where two upper extremities are connected to the trunk. That part here can be taken as Trika. According to commentator of Ashtanga Hridaya, Trika is taken as vertebral column and pelvis which supports the back region. Again here there is a controversy in the place Trika. Next slide please. Kledaka kapha is the one which is located in Amashaya. Amashaya sthitaha anna sangatasya kledanat kledakaha. The one which gives moisture to the food, that is called as Kledaka kapha, which is located in the Amashaya. Next please. Yastvamashaya samsthitaha kledakaha sona sangata kledanat. Kledaka kapha is the one which is located in the Amashaya, and the one which is responsible for doing kledana, for giving moisture to the food which is entered in the Amashaya. That is the function of Kledaka kapha. Next please. Yes, Tarpaka kapha is the one which is located in Shira and which does the snehana, which gives santarpana. Shirastaha sneha santarpanadi kritatvat indriyanam atmavirena anugraham karoti. It Tarpaka kapha, it makes tarpana of all the indriyas, as Shira is the place, Shira is the location for Tarpaka kapha. It remains in the head region and keeps all the special sense organs fresh. For proper functioning of special sense organs, Tarpaka kapha is essential. Next slide please. Next please. Next please. Yes, Tarpaka kapha. Tarpaka kapha is located in the Shira region and it makes tarpana of all the indriyas. Next one. Shleshika kapha is the one which is located in the joints, like Parvasto Asti Sandhi Samshleshat Shleshaka iti. Shleshaka kapha is the one which is located in the joints and which gives slish alingane, as the derivation of kapha goes. It makes lubrication, it facilitates lubrication between the bones and in the joints. So wherever two parts comes together, wherever two joints comes together, there Shleshaka kapha will be there, which will provide lubrication and which will avoid the scratching between the two parts. Because of its lubricating agency, Shleshaka kapha is useful for that function. Next please. Sandhi samshleshat shleshaka sandhishu sthitaha. Shleshaka kapha is present in between the two sandhis and it gives proper lubrication to the bones or to the joints. Next please. So this is the summary of 5 types of kapha. Next please. So disease is the one when we want to split, it becomes dis is disturbed, ease is the comfort. Though there will be disturbance in the comfort. So that is how the word disease is produced. It is a disturbed comfort of the body, either partly or completely. When this happens, it will lead to the disease. Yes, moving on to the conclusions. 3 doshas, that is Vata, Pitta, Kapha in general, they represent neural, endocrine and immune mechanism respectively and form the basis of neuroimmunoendocrinology. As the function of Vata we can compare with the nervous system, function of Pitta we can compare with endocrine system, function of Kapha we can compare with the immune system. So totally the function of Vata, Pitta, Kapha can be considered as neuroimmunoendocrinology. Next please. Next slide, please. So basically 3 doshas, Vata, Pitta and Kapha are responsible for maintenance of homeostasis in the body, and health is nothing but a state of equilibrium of these 3 doshas, and disease is manifested as a result of disturbance in the state of equilibrium among these doshas. Next, please. So moving on to summary. As is the physiology, so is the pathology. If you know physiology well, you can differentiate pathology. As is pathology, so is the medicine. If you are good in pathology, very easily you can diagnose disease and you can do the treatment. As is medicine, so is the practice. If your treatment is good, definitely you will be having good practice. As is practice, so is the status in society. If your practice is good, automatically your status also will be good in the society. Next. Thank you. Any doubts are there? Please can ask. Yes, Deepa Patil. Mana is one of the Nava Karana Dravya. Yes, it is. There are 9 Karana Dravyas which are Karana, cause for Karana Dravya. They are 9 in number. They are Panchamahabhutas, Atma, Mana. Dik.
Thank you very much, ma'am, for taking your time to prepare for such an extraordinarily enlightening session, which was incredibly informative. We will now go ahead to the question and answer session. Shall we begin, ma'am?
Yeah, sure.
Delegates, please post your questions in the chat box.
Ma'am, shall I read out the question, ma'am?
Yeah, sure.
Why it was necessary to accept Tridoshas when Panchamahabhutas could have resolved all confusions because dravyas used to treat are also made of Panchamahabhuta.
Finished?
Yes, ma'am.
Yeah. Panchamahabhutas are the dravyas, and they on the basis of Panchamahabhuta also one can treat, but it needs a lot of expertise. Whereas if we three doshas are the mool of the sharira, Panchamahabhutas are the part of sharira, no doubt. Our body is also made up of Panchamahabhutas, but three doshas are the base. We can see the functions of three doshas. We can see the karmas of three doshas. We can see vriddhi and kshaya lakshanas of three doshas, on the basis of which we can do proper treatment. No doubt, Panchamahabhutas help also we can take for doing treatment, but the functioning of Panchamahabhutas very exactly we cannot see in our body. If we can see, their vitiation we cannot see. Vitiation, if we see, dushti lakshanas, if we see, the treatment can be done easily. That is done with the help of three doshas, not with the help of Panchamahabhutas. No doubt, three doshas are also made up of Panchamahabhutas. Oh, one can choose drug. Yes. Dr. Tomar.
Question.
How? Yeah. Read next one.
Explain Samprapti Gatakas in all doshas.
Samprapti Gataka is based upon the deceased condition, no? It cannot be explained with the, no doubt, Shatkriya Kala, if we want to take help, we can take. But Samprapti Gataka, if we want to take, there the manifestation of disease is needed. It varies based upon different disease. Hormonal imbalance. What is this question? Dr. Asharaniyam, how to classify hormonal imbalance with
doshas and man? How to classify hormonal imbalance with doshas and management?
Doshas and management. Yes, hormones are nothing but pitta. The functioning of pitta, we can say hormones, or the hormones are nothing but the pitta itself. There are many kind of hormones. We can see very keen observation we can do to correlate which hormone is coming under which type of pitta, so that the treatment can be done easily. Hormones, hormonal imbalance, we have to treat with very carefully if we want to apply Ayurveda treatment. Why Udana Vayu is Pavanottama, ma'am? Deepa Patil. Why Udana Vayu is Pavanottama? It is considered as like speech is considered as the best function seen in the humans. So this Udana Vata is entity which will help for the speaking. So that is called as Pavanottama. Another answer what we can give is Udana Vata is located in the upper part of the body. Upper part is Shira. Shira here is Uttamanga. So the Vata which is located in the Uttamanga, that is also called as Pavanottama. Yes, any other questions?
Thank you. Ma'am, one question. How one can choose drug of choice in different types of Vata, Pitta and Kapha vitiation or Kshaya Avastha?
Yeah, based upon the functions, we can see the qualities of dravyas also. Like what are the karmas of that dravyas, how they are in nature. Like Shita Ushna are there, Snigdha Ruksha are there. Based upon their gunas, based upon their karmas, we have to decide. For that, we need to study dravyas also. Not only with these doshas, it is possible, but by studying the studying of dravyas is also very important before going to decide the treatment. Okay. Any other questions? Dr. Sri Lakshmi?
Hello.
Yes.
Good evening, madam.
Yeah, good evening.
Very informative lecture, ma'am. Thank you so much. I just wanted to check how did you experience avarana in your practice?
Avarana.
And how do you assess avarana?
Avarana, there are, what is the meaning of avarana according to you? Obstruction. So, avarana
Yes,
is the
ma'am.
obstruction.
Covering.
No? Yeah, hampering of the normal functions. Normal functions will be disturbed. That we can consider as avarana. Again, there are many type of classifications are there in the avarana. So which doshas functions are obstructed, that we have to see, and we have to decide which type of avarana it is. Actually, it is a very difficult concept to assess avarana aspect. No, little difficult. It needs again expertise for assessing this avarana. Yes. Any other
Thank you,
doubts are
madam.
there? Okay. Any other queries?
Delegates, any more questions?
I hope I have done justice to the topic, and I take this opportunity to thank Dr. Vadi Ukarsi and the all whole of the team of DIKSHA E-Learning and Dr. Sri Lakshmi for helping me to open the slide, all other etc. things, and the Ayurveda College Coimbatore and the principal of the college. I want to thank wholeheartedly. Thank you one and all.
Thank you very much, ma'am. Now,
Okay, thank you.
I request Dr. Anu, Assistant Professor, Department of Kriya Sharira, Ayurveda College, Coimbatore, to deliver the vote of thanks. Over to you, ma'am.
Thank you. Good evening, everyone. On behalf of Ayurveda College, Coimbatore and Team Diksha, it is my privilege and a great joy for me to extend a vote of thanks for today's section. First of all, I would like to express my sincere gratitude to Dr. Prathibha Kulkarni ma'am for showing light into the topic Tridosha Siddhantha. I am sure that the participants are immensely benefited by being here. Thank you, ma'am. Last but not least, I extend my thanks to all our delegates here who are untiringly taking part in our sessions. Hope to meet you all in our upcoming sessions also. Thank you, one and all.
Thank you. Thank you one and all. Shall I leave?
It's the province of knowledge to speak, and it's the privilege of wisdom to listen. Thank you all for your patient listening and the valuable time spent. To know more about our updates, please do stay tuned with our social media platform. That's all for today's most interesting session, with lots of new information for us to close our eyes with thought provoking knowledge. Thank you all for joining us. Thank you.
Thank you one and all.
Thank you, ma'am.